Welcome back to the Healthcare Huddle video podcast. I'm Rachel Slauson and I'm your host of this show. And following on from our previous episode, we will be talking about how to consider communication and training whilst undertaking an investigation into transmission of COVID-19 within health and social care settings. So if you haven't watched the previous episodes, I'll have a link in the description. You need to go back and listen to those and you will get some really awesome advice from Leslie Underwood, who is our registered nurse and public health professional. Leslie wrote an article titled Investigating Transmission of COVID-19 within Health and Social Care Settings. You can find that article at the Fascia Mellius website, which is fascia-mellius.org.uk. I'll have a link in the description, so if you want to go and check it out, definitely do that. We aim to have 5 episodes of this series, and they're aimed at health and social care professionals to help you gain a bit more understanding about the benefits of undertaking a investigation into COVID transmissions within health and social care settings. So I'll have a link in the description where you can find the other episodes, as I say, because it's really important you go and listen to those. CMLIS are sponsoring this series of podcasts, and they are a healthcare consultancy firm which offers a unique combination of insight, innovation, and experience. They specialise in quality, governance, and patient safety investigations. I'll have all the links in the description so you can go and check them out. In the next episode, we'll be diving further into other areas as well. We've got lots of exciting stuff. And the final episode, we need your help with. We'll be doing a question and answer. And so we want you to submit your questions that you want us to answer, and we will film a response to those. So look out for that on social media and post your comment down below. So hi, Leslie, how are you?
Fine, thank you, Rachel. Nice to see you again.
So Leslie, for those who haven't listened to the other episodes, which we highly recommend, do you want to discuss the background of this article?
Yes, certainly. I wrote this piece a few weeks ago now. My background is in investigations, it's in governance, it's in quality, it's in patient safety. And I was thinking, I hadn't heard a lot about people doing anything in terms of looking back to see what they did well, or indeed see what they could do better. So I just thought maybe people haven't really got to the point where they can start reflecting yet. So my idea was to just get the paper out there so that people can just start to think about what they did well. And it sort of guides them through the process, really. So it's sort of an aid memoir, just to help them out.
Yeah, it should be really helpful. And we have actually created a checklist that people can go and download at the Fascia Mellius website, which will hopefully help them out during any investigations that they undertake. So look out for a link in the description for that. If we were looking at training, what are the basic principles that people should be looking into when doing this investigation?
Okay, so I think we're probably looking in terms of a bigger investigation rather than the debrief type investigation we were talking about yesterday. So what I would be looking at is what sort of training the people involved had. So have they had their basic training? Have they had their mandatory training? And if they have, is it up to date? Obviously, mandatory training is about your fire, it's about your health and safety, it's about your basic infection control. But that's the starting point. From there, you need to look at what's basic training for different levels of staff. So what you would expect each member of staff to have, depending on what grade they are, what their responsibilities are, what their job description is.
Yeah, and that could actually have changed, couldn't it? Because people were potentially working in different areas under different conditions than they normally would. So they might have been at one level with their training in one respect, but actually if they changed areas, you've got to make sure they're up to date for that particular area. I'm thinking of anyone who maybe had to go and work on ICU.
Yeah, definitely. And also those people have come back to work. You know, if you've been retired for a couple of years and come back, what sort of training did you have to prepare you for the role that you would be undertaking, you know, in the new world?
So we were just discussing that some people came back, were in a different area. There were people that were on different parts of the hospital they might not have worked in, or out in the community doing things that they hadn't done before. Was there anything specific around COVID that should have been covered in the training?
Yeah, I would have expected them to have some sort of transmission-based infection prevention and control training. We knew early on that this was a virus, it covered by droplet infection, that sort of thing. So I would have expected people to have some sort of IPC, infection prevention control training around how COVID spread, what we should do in terms of isolation with people. Now, obviously, in the very, very beginning, we were using the very high-tech hospitals because cases were so low.
Yeah.
But as the virus spread, we were using our general hospitals. We were actually using care homes as well to isolate people. So I would have expected some form of training in how to isolate somebody safely. There would also be the increase in PPE and the use of PPE and the intensity of that PPE. So going from maybe a simple surgical face mask to the FFP3 mask, the respirator mask that people were using, that you see them using in intensive care.
Yes.
There's a different level of training to be able to use those. So I would have expected that there would be that sort of training given. How to put on your PPE, how to take it off, donning and doffing as we call it. It goes on and off in a certain order. So I would expect that training to be done as a practical session. But there's also this bit about when did they have that training? So was that just before they went into post? So it's really fresh in their mind, or was it done a few years ago? You know, was it or last year or 12 months back or however long the cycle is, depending on where those people work? Because as we know, different contracts have people doing different levels of training at various points. It might be annually, it might be twice a year, it might be every 2 years. So really it does change. And I think as an investigator, you need to make that decision as to how often that should happen.
And also around, I know we'll cover staffing later, but actually around agency staff and their availability of being able to access that training. Because if you urgently need a member of staff tonight, for instance, you're going through an agency, they might have done the basic level, but you don't know whether or not they've done the, I don't know if that's a problem, but it might be a problem, couldn't it? That they need
can be. Yeah, you don't know what agency staff have had. You don't know the quality. And therefore, yeah, it can be very important. But that also leads me on to actually the quality of training and where people access their training from, which is another important thing. In any investigation I undertake, if training is an important factor in it, I will always have a look at that training and perhaps do it myself, just to try and gauge the quality. Is it a simple question and answer in terms of multiple choice questions? You know, do people watch a film and then answer multiple choice questions, or are they actually challenged? Is their level of understanding challenged? So again, there's all different courses out there, and I think it just, you need to understand what those courses are and what your staff have undertaken.
Should all settings have similar training and access to expertise?
No, certainly not. You look at acute hospitals, they have infection prevention control teams, infection prevention control doctors, but you head out into places like mental health services, for example, learning disability services, your private sectors, social care. They have differing access to different people. Some of that might be through district nursing services and therefore through community trusts and their infection prevention control. But otherwise, they actually tend to look after their own. So they can access via CCG perhaps, or employ their own. So it's different for everybody. And you would hope that with the acute hospitals, that's where the really poorly people are and where the majority of the infection is. But actually, I think we found in COVID it wasn't. As we know, lots of care homes had lots of COVID. And we really need to upskill their staff to ensure they can cope with it next time.
Yeah, definitely. Where would staff have access training?
Some people would have got it through their mandatory training. So they would have mandatory training providers. So that could be, if you have an infection prevention control team, if you're looking at IPC, it could be that they actually went online and looked for an online course. It could be they have an external provider who specialises in providing your mandatory training for you. There are lots of providers out there. But going back to what I said, vary in quality. So you need to be assured of your quality of what you're actually buying or downloading if you're actually getting it from the internet.
Is there anything else that people should consider whilst undertaking this investigation in relation to training?
That's probably the majority. We covered the majority, because obviously infection prevention control is the mainstay. But there is also the training involved with equipment, because people will be using new pieces of equipment. You know, we've heard on the news, we've got the ventilators in, we've got the CPAP machines and all this sort of thing. So you do need to be assured that people are trained in how to use those, how to disinfect them, how to decontaminate them. Because actually once a piece of kit has been used, if it's not single use, it does need to be cleaned. So there's that element to it as well. And also things like isolation techniques. You know, when do you use a single room as compared to a bay of 4 or a bay of 6? Again, people will use their best judgment and will do things to the best of their ability. We're not knocking people for this. That's absolutely fine. But if they had a bit of training, would they have done something differently? I suppose is really what you're looking at when you're doing this sort of investigation.
Yeah, information is definitely power.
Indeed.
The better you can equip your staff, the better decisions they'll make under tough situations. Obviously, this is a really big topic, but we do have to move on to discuss communication. What role do you feel communication played during this outbreak? I have a lot of feelings about this, and I think it was pretty big, but yeah, I'd like to hear your opinion.
Definitely big. Communication for whatever you're doing is very, very difficult. And certainly when we look at investigations, you would look at communications, you'd look at how those communications were shared amongst staff. When you look at the NHS, it's a vast organisation, it's got millions of staff. You look at social care, the same thing. Community services, your staff aren't even based in the same place. Mental health services is similar.
Yeah.
You know, it is an absolute nightmare to try and make sure that everybody is on the same page and has the same information.
Yeah, definitely. But the investigation wouldn't just look at internal comms, would it? It would also cover external communications?
It would cover external, yeah. So it would cover information that's coming in from commissioners. It would cover information that's coming in from families and service users, because actually if they're telling you that one of their family is ill, what does that mean for you and your team? So there's those sorts of communications, but then you've got the communications that come down from government. So you maybe have changes in practice. There were certainly changes in use of PPE throughout the pandemic. So it's literally, how are those communications shared amongst staff? How do you know that message has got through to the people that it needs to get through to? So I would certainly look at communication plans, or if they don't have a set plan, and some people may not, actually how they expected that communication to get through.
And whether or not it was effective at getting through, because it's one thing to send an email out, but it's another thing for a member of staff to actually open it, read it, and take it in. You know, it's sometimes communication go out as very passive, but actually you need a bit more like a conversation. Have you seen this? Have you seen that? This has changed. Because sometimes
but it's also the understanding of that as well. It's not just the message, it's the people understand what that actually means. So yeah, it is very, very difficult. And I hate emails in terms of that's our method of communication, because people don't have time to open them. And when you actually do the research into, you know, what's the best method of communication, emails and electronic communication isn't high on the list of people's priorities.
What do you think were the difficulties around when the government changed their approach during the pandemic?
I think there were changes coming practically every day. And some teams had one person managing the communications in terms of checking what the government was saying every day. So literally going onto government websites and checking and looking and seeing whether that made a difference to them, because some communications weren't for everybody. Others just waited for that to filter down. So therefore, each organisation managed it differently, and that's fine as long as they actually took on board those changes and introduced the changes where they needed to be. Controversial changes came through, and they were sort of picked up by the media that the use of PPE is changing. Some things are having to be reusable that should be single use. You know, these things happen. We're in a pandemic situation where we've never been here before. We don't know what we're dealing with, and we're having to firefight. And that's fine as long as the information and the different methods of working were translated to people in a way they understood and didn't feel frightened, because I think certainly changes in PPE made people feel frightened. The whole thing needed to be managed properly.
So talking to staff during this process, you want to understand what really worked for them and what didn't, and not carry on with the modes of communication that were really unpopular, and doing the things that actually made the biggest impact. You know, list them out, you know, email, face-to-face meeting, a thing up next to your kettle in the kitchen. And if they worked, then, you know,
exactly.
use whatever one it was going forward.
And if you're not doing a large investigation, actually, as part of a debrief session, so the smaller type investigation we were talking about in our previous sessions, actually, that's a really good thing to look at. Because if staff can sit there and say to you, well, actually, I never ever opened an email, but I did look at the piece of paper that was by the kettle, you know, I did see that message there. Or the safety huddle we had every morning was brilliant because that's when I really picked up the information.
Yeah.
Actually listening to those staff and saying, right, okay, this is what worked for us, this is what we can use again. This is what this is about. It's not about you know, looking for tricks and things. It's about looking for what works.
Yeah, and what benefits the staff at getting that message over in the most effective way that they can ingest it.
But it's the staff who will tell you, it's not us telling you. You know, it really is the staff who should drive this.
Yeah.
But I suppose something that's just come to my mind, and this is how investigations evolve and work as you do them, you need to include everybody, and everybody needs to understand that. So if a change happens, it isn't just the clinical staff, the staff who are administering the hands-on care, it's the whole team. So it's your domestic services, your domestic staff, it's your portering staff, it's your drivers. They all need to understand what it means for them. So whilst they may not need to know how to put on a full PPE kit, including a respirator, actually they may need updating in how to clean their hands. They may need updating in how to put a surgical mask on and an apron and how to take that off, because under normal conditions they may not have been using them. So you do need to include all of the staff in this.
Yeah, and admin staff, because there's a lot of admin staff in hospitals. Thank you so much for that discussion, Leslie. It was really, really helpful and informative. If you want more information about the article or the free downloadable checklist, visit the Fascia Melius website. So that's fascia-melius.org.uk. So that's spelled FACERE-Melius, MELIUS.org.uk. We'll have all the links in the description. You can also follow Fascia Melius on LinkedIn and Twitter, and we want to thank them for sponsoring today's episode. So as I said, we've created 4 podcasts, and we'll be releasing them on Tuesdays and Thursdays for the next couple of weeks. And then the 5th episode, we need your help with. So we need you to submit questions that we can answer on our last podcast. So either comment in the description, comment in the comments below, or head over to our social media and leave your question there, and we will hopefully be able to answer them. And next episode is around leadership and staffing, which I think will be a really, really interesting topic to talk about in terms of the investigation and what areas you can look at. If you are joining us via YouTube, please like and subscribe and hit that notification bell so that you can get notified of our next video. And if you're listening on a podcast, then please subscribe. Thank you so much for that, Leslie. Really, really appreciate your time. Really appreciate your expertise as well. And thank you everyone for watching and listening. I hope you enjoyed it as much as we did. Stay safe and see you next time from everyone at the Healthcare Huddle.